Welcome to The Explainer. Today we are diving deep into your body's own amazing electrical grid, the peripheral nervous system. We're going to figure out what actually happens when these critical communication lines get damaged, and most importantly, why one injury might heal completely while another can change a life forever.
You know that feeling, right? You'll fall asleep on your arm and it goes completely numb with that pins and needles sensation, but then a few minutes later, it's totally fine. So what's the deal? How can that happen when other nerve injuries can lead to permanent paralysis? Well, that massive difference is the exact question we're answering today. And you'll see the answer really boils down to one thing: just how badly the nerve itself was damaged.
So to really get this, let's start with a simple idea. I want you to picture your peripheral nerves as these incredibly advanced electrical cables. They're not just simple wires. No, they are complex, layered structures built to carry messages between your brain, your spinal cord, and literally every other part of your body. Okay, so what happens when one of these cables gets squished, or stretched, or even completely cut? Well, the problem doesn't just stay in one spot. It's more like a domino effect. Damage to a single nerve can set off this whole cascade of problems, messing with your ability to move, what you can feel, and even the automatic stuff you never think about, like how your body controls blood flow. This damage really does trigger a cascade of complications. So let's break down what that actually looks like. We'll split it into three main buckets, and we'll start with the most obvious one: how it impacts our movement. Your motor nerves are basically the command lines from headquarters, your brain, telling your muscles what to do. So when these nerves get damaged, the muscles are suddenly cut off. They're not getting any orders to move, and maybe even more importantly, they stop getting these vital background signals that nerves send to keep muscle tissue healthy and alive. And that disconnection leads to some really devastating problems. It might start a simple muscle weakness, which is called paresis, but if the nerve damage is bad enough, that can turn into a total loss of movement or paralysis. And it doesn't stop there. Without those nerve signals, the muscle itself literally starts to shrink and waste away. That's a process called atrophy. This is exactly what causes things like wrist drop or foot drop, where you can't lift your hand or foot. And over time, this muscle imbalance can actually pull on your joints, creating permanent deformities like a claw hand. Okay, so that's what happens to your muscles. But what about what you can feel? Well, damage to your sensory nerves can create this bizarre and frankly dangerous world where sensations are either wildly distorted or just gone. It's really a two-sided coin. On one side, you can have this horrible chronic nerve pain. People describe it as burning or shooting, like an electric shock that just won't stop. But on the other side, you can lose feeling entirely, and that is so dangerous. Think about it. Pain is your body's fire alarm. Without it, you could rest your hand on a hot stove or get a serious pressure sore and have absolutely no idea until the damage is incredibly severe. And finally, there's the unseen damage. See, running alongside all these other nerves are autonomic fibers. These are the ones on autopilot, controlling all the background functions your body just does. And when they get damaged, the symptoms can get really weird. You might see problems with blood flow, leaving you with hands or feet that are always freezing cold or swollen, or even have a bluish tint. The skin itself can change, becoming shiny and thin. You might even see hair loss or strange changes in your fingernails. And in the absolute worst-case scenarios, this all spirals into something called complex regional pain syndrome, or CRPS, which is just this awful state of severe, chronic pain that takes over an entire limb. Okay, so we've seen just how bad things can get, which brings us back to our big question. How do you get from a simple dead arm that's fine in 5 minutes to a permanent claw hand? Well, the answer is realizing that not all nerve injuries are created equal, not even close. The key, the absolute secret decoder ring for all of this, is something called the Seddon classification. It's this beautiful, simple framework that sorts nerve injuries into 3 different levels based on how bad the physical damage to the nerve is. This is what lets doctors predict whether a full recovery is likely, just possible, or, unfortunately, almost impossible. And it works perfectly with our cable analogy. Let's break it down. Level 1, the mildest, is neuropraxia. This is your dead arm. The cable is just squeezed or compressed, which temporarily blocks the signal, but the cable itself isn't broken. So once the pressure is off, you get a complete recovery. Easy. Level 2 is axontomesis. Now it's more serious. Here, the inner wires of the cable, the axons, have actually snapped. But, and this is crucial, the outer insulation, that little tube around each wire, is still intact. This tube acts as a perfect tunnel for the nerve to regrow. So recovery here is possible. And then you have level 3, the worst, neurotomesis. This is when the entire cable, insulation and all, is completely severed. The wires are cut and their guide tunnels are gone. Without a path to follow, the nerve just can't regrow properly. The outlook here is really poor without major surgery. So what about that middle ground, those axonotomesis injuries, where recovery is on the table? How does the body actually pull that off? Well, it kicks off this fascinating high-stakes process of demolition and then very, very slow reconstruction. The whole process is called Wallerian Degeneration, and it's pretty cool. First, the body sends in a cleanup crew to get rid of all the broken, downstream parts of the nerve fiber. It has to clear out all the debris, and only when that's done can the rebuilding start. But unlike a cut on your skin that heals in a week, nerve repair is this painstaking, microscopic construction project that follows a very strict and very, very slow timeline. And when I say slow, I mean unbelievably slow. A regenerating nerve can only grow at a top speed of about 1 to 3 millimeters a day. That's it. Best case scenario, you're looking at about an inch a month. Now, let's put that speed into real-world terms. If you injure a nerve at your elbow, it can easily take over a year for that slow-growing nerve fiber to make it all the way down to the muscles in your hand. It's this desperate race against time. The nerve has to get there and reconnect before its target muscle wastes away for good. It is a biological marathon, not a sprint. And for the nerve to have any chance of winning that marathon, the conditions have to be absolutely perfect. It needs that intact guide tube, the insulation from our cable analogy to show it where to go. It needs a fantastic blood supply to bring in all the fuel and building blocks. There can't be any scar tissue in the way blocking the path. And it's just a fact, the whole process works a lot better when you're younger. So given how painfully slow nerve recovery is and how serious the complications can be, it's probably pretty obvious what the best strategy is, right? It's to avoid the damage in the first place. And prevention really happens on 3 different levels. First, you've got primary prevention. That's just stopping the injury before it even starts. Setting up your desk properly, using safety gear at work. Then there's secondary prevention, which is all about catching problems early. If you start to feel numbness or weakness that isn't going away, don't just tough it out. Get it checked out. Catching it early can stop a small problem from becoming a huge one. And finally, if an injury does happen, there's tertiary prevention. That's rehab, physical therapy, stuff to limit the long-term damage and prevent those permanent deformities we talked about. So here's the bottom line. Your nervous system is this amazing, resilient network that is constantly trying to protect and repair itself, but it's not invincible. The huge gap between a dead arm that wakes up in minutes and an injury that takes years to heal, or never does, it all comes down to the level of damage and how well we can prevent it or intervene early. Your body is doing its part. The question is, are you helping it?